Hello everyone, thank you so much for joining us today. My name is Felicia Chiang. I'm a volunteer at Lens of Youth, and I am super honored to be joined by Dr. Freelove and Dr. Annikka. And this is her baby, Keely, who's super cute. Okay, so today we're here because we recently found out that you guys offer special services for individuals with developmental or intellectual disabilities. And we were wondering how you started this and why you guys did it.
That's a really good question. So I'm a board-certified pediatric dentist, and as part of pediatric dentistry, we're the only recognized dental specialty that takes care of individuals with special healthcare needs. So that in our area includes mostly children, though some also young adults who may have difficulty receiving dental care in a setting that's not designed with them in mind. So one of the things we wanted to do for our practice is make sure that we have some flexibility to offer care for everybody. That's important to us to serve the community here. I grew up in this community, and practicing here is really important to me. So we offer dental care from birth through like teenage years and some young adult years. A lot of our patients may have some sensory processing difficulties and may have had some traumatic dental experiences in the past. That's a really common situation. So we have a lot of flexibility to do things like offer kids a private room if they do better, or a large open space if that's better for them, more or less light, more or less music. We also can do things at a different speed. So some kids do really well with a very slow introduction to dental care, coming back more frequently and doing less at each appointment. Some kids do better with some pharmacological help. So we have laughing gas that they can do or not do. And if there's a lot of invasive treatment that somebody can't tolerate, then we do have an anesthesiologist who can come into the office. So we have a lot of different ways we can help kind of customize things for kids and for teenagers too. And that has been really helpful, I think, for a lot of our families.
Yeah, that's really meaningful and also very thoughtful of you guys. Yeah.
Thank you.
It's never really a thought of, to not be inclusive of everybody, right? We want to help. We want to make sure everybody that needs care for pediatric or orthodontics has a way to do it. So we are fortunate to share space with my wife and her pediatric setup. That allows us, for orthodontics at least, we can offer private rooms. We can offer nitrous for kids that are either need some sort of privacy or a toned down environment to make them feel comfortable with getting braces or getting their Invisalign or anything like that. So it's been super helpful for us. Yeah.
We've also done some things like we've had some families where they're not sure if their child will tolerate an orthodontic appliance, and we have the flexibility with our 3D printer to print them kind of like a trial appliance, so the families can take it home before they're making this big financial commitment, and make sure their child is actually going to be able to tolerate the treatment. And then even when they get their braces or their Invisalign, usually that's one really long appointment, but we'll also split it up for them on the orthodontic side if they need just more time, if it's too overwhelming to have everything done at once. So we really try to make not just the pediatric dental side, but the orthodontic side really inclusive, like you were saying.
Yeah, that's so thank you so much for your answer. I feel like it was really insightful. I actually had experience with braces and Invisalign myself, and I know how it feels. It's very sensory disorientating, and it's amazing that you guys can help with all of the maybe lights or other perceptions. So that's really great. Thank you. And for my last question, I was wondering what you guys think about our Misunderstood Moments program, and if you have anything to say to the public about it.
The Misunderstood Moments that you guys are doing is really awesome to bring more awareness to those moments where parents or caregivers might feel very flustered by other people's perception of their child's difficulties, whether they're having a meltdown somewhere and they feel other parents may be judging them. I think it's really great to bring some awareness to the fact that people may be misinterpreting the behaviors. A lot of kids, even at the dentist, have a misunderstood moment where somebody might think that they're trying to be uncooperative or trying to be combative, or that they're being bratty or something like that, when the reality is that the child may just be having a really hard time dealing with the dental environment. It can be very new, sometimes very fast-paced. At the dentist, we have a lot of sensory input, different smells, different textures, different flavors, different sounds, vibration on their teeth. It can be overwhelming for anybody, especially kids who may be having intellectual or developmental differences. So I think this is a really cool campaign to just bring awareness to other families who maybe aren't as aware of the families who have children with intellectual or developmental differences and the challenges that they face. And I think bringing a little compassion and empathy to the community is a really good thing.
Thank you so much. Yeah, that's a really good thought to share to the public. Yeah. And we're so glad once again that you guys joined us and with baby Keely.
Yeah. Thanks.
Yeah.
Did you have anything you wanted to add to that? Or?
It's relevant to everyone else, what is going on through their minds and through their heads. And so that sort of awareness into helping their kind of psychology and their psyche can help them better to interact with them and make them feel comfortable. So
Yeah. Thank you so much, you guys.
Yeah.
Thank you.